Is thigh pain slowing you down? Fortunately, the solution may be simpler than you think. In this video, I'll share targeted exercises for different types of thigh pain so you can get back to moving comfortably again. If you have pain in the front of your thigh, it can come from stiff quadriceps or hip flexor muscles, or it can also come from a nerve that runs down the front of your thigh called the femoral nerve. Fortunately, though, the treatments for both of those look somewhat similar. To find out if you have stiff hip flexors or quadricep muscles, particularly one called the rectus femoris that crosses both the hip and knee, you'll lie down on your back at the edge of the bed, bring one knee up towards your chest, and then let the opposite one drop down. You want to make sure you're keeping your lower back flat on the bed, and then this is the leg you're testing. So ideally, your thigh should fall all the way flat down to the table, and your knee should bend 80 to 90 degrees. If that doesn't happen, then you have stiff hip flexors. And stiff hip flexors are one cause of front of the thigh pain. Now, the test here can become the exercise. So if you find that you're stiff in the test, just holding this position and doing some deep breathing, breathing in, breathing out, and relaxing into the stretch can be a great way to help relieve it. You can also actively contract your buttock muscles and your hamstring muscles to bend your knee and pull your thigh down towards the floor. That's another good way to stretch your hip flexors. Now, the femoral nerve starts out in your lower back from the L2, L3, and L4 nerve roots and runs down the front of your thigh. So this position actually puts the femoral nerve on tension. However, for nerves, you don't want to keep them on tension. So just going back and forth in a gliding motion like this can help relieve the thigh pain as well. So try doing the static stretch, try doing the nerve glide, and see which one helps you out better. Now, another way to stretch your hip flexors, and probably the one that I like best, is kneeling on a bed or the floor like this. You'll put one leg up and then you'll lunge forward. Now make sure you don't arch your lower back here. You want to keep your lower back flat, so do a little pelvic tilt, squeeze your bottom muscles, and push your hips forward. There you should feel a nice stretch in the front of your thigh, both for your iliopsoas, which are hip flexors, as well as for your rectus femoris, which is also a hip flexor. To do a little nerve glide here, you can just go back and forth and kind of oscillate. So stretch on, stretch off, stretch on, stretch off. And so as you can see, the solution for both types of those problems, the hip flexor and quad problem or the femoral nerve problem, look fairly similar. So that's the first one. Now, since I'm in this position, I want to show a stretch for outer hip pain, because one way that you can get outer hip pain is from stiffness in your IT band or your tensor fasciae lata, a little muscle that attaches to the IT band, or the lateral femoral cutaneous nerve, which goes down the outside of the thigh. And all of those can become problematic if that tensor fasciae lata is too stiff. Now, the tensor fasciae lata is also a hip flexor. So doing this hip flexor stretch does help stretch the TFL. If you stick your hip slightly out to the side, that puts a little bit better stretch on that tensor fasciae lata. And then you just hold that position for about a minute. Now, another thing that can help both front of the thigh pain as well as outer thigh pain is using a massage gun. Using a massage gun on your quadriceps as well as on your outer thigh can help. However, you don't want to use the massage gun right along the IT band because that does get a little bit uncomfortable. Your outer quadricep, your vastus lateralis, actually runs underneath the IT band. And so massaging the vastus lateralis on front of the IT band as well as the vastus lateralis behind the IT band can be helpful for outer thigh pain. So how you do that, you would turn the massage gun on and just run it up and down the front of your thigh. If you happen to notice some spots that are stiff or knotted or painful, just hold a little bit of pressure on that area for around 30 seconds or until it relaxes. And then move on to the next spot. For the outer thigh, again, you don't want to go right over top of the IT band. Go just a little bit in front of it on the vastus lateralis and a little bit behind it on the vastus lateralis. You can also use the massage gun on the tensor fasciae lata, which comes right off of the front hip bone here and runs down in the direction this way towards the side hip bone. So find the front hip bone, find the side hip bone, and then go kind of in between there, and that's the tensor fasciae lata. Now, by the way, this one is the Bob & Brad X6 Pro Max massage gun. I really like it because of this metal head. You can get really deep into the tissues with it. Another place that's really good to massage for outer thigh pain is on the gluteus medius and gluteus minimus on the outside of your hip. These muscles often become weak, and they work together with the tensor fasciae lata. So when these muscles are weak, the tensor fasciae lata has to take over and becomes too stiff. So for that reason, doing gluteus medius and gluteus minimus strengthening exercises are also a good idea for outer thigh pain. One way to strengthen the gluteus medius and gluteus minimus is doing clamshells, which if you've ever had therapy for back pain or hip pain or knee pain, it's very likely you may have done these before. However, many people do them wrong and activate their tensor fasciae lata too much. Your tensor fasciae lata is also a hip abductor, and so if you allow yourself to roll back when doing these or allow your back to roll back, this way you can recruit the tensor fasciae lata, which is usually too strong and working too hard anyway. So to activate your gluteus medius and minimus doing a clam, you want to make sure you really roll forwards a little bit farther than you think you should probably have to. Then focus on just tightening these muscles on the back side of your hip and lifting just slightly like that. Now you'll notice that this is a rather small movement. You don't want to allow yourself to roll back this way, so make sure you stay rolled forward. Just think about contracting the glute muscles and then doing a slight lift of your knee. It's more important that you activate the correct muscles than how high you lift the leg, so just focus on getting the correct muscles to work. Hold for about 10 seconds, and then repeat that for 10 repetitions. Now, if this gets too easy, you can also start to straighten your leg, which increases the lever arm of the exercise and makes it more difficult. However, you don't want to lose the external rotation of your hip, because again, if you start going into internal rotation, that brings the tensor fasciae lata back into the movement. So make sure you hold the external rotation and then straighten the leg out for a more difficult version of the clam. Now, strengthening your gluteus medius and gluteus minimus is also a good idea if you have inner thigh pain. And the reason for that is that the inner thigh muscles or hip adductors often get too stiff. The hip adductor's job is to pull the legs towards midline. So strengthening the gluteus medius and gluteus minimus that do the opposing action of pulling the leg away from midline is also a good idea if you have inner thigh pain. Now, in addition to strengthening the outer thigh muscles, you do want to stretch the inner thigh or adductor muscles. One good way to do that is to sit with your feet together like this. Pull the feet in towards your groin as much as you can comfortably, and then let your knees drop out to the side. For a greater stretch, you can press down with your elbows, and that'll pry your thighs apart and give you a little bit greater stretch on the inner thighs. Now there's a nerve that runs down through your inner thighs as well called the obturator nerve. And the obturator nerve can also be a source of inner thigh pain. So to do a nerve glide for the obturator nerve, you'll stand up and go in a wide stagger like this. If this is the nerve we're gliding, you just go back and forth, kind of taking the hip out to the side and then coming back in. Now this also kind of strengthens your hip on the opposite side. So if you're going to do both sides, you go back this way, and now you're gliding the obturator nerve over here, while also strengthening the outer hip muscles on the opposing side. And then finally, we'll move on to back of thigh pain. And that's probably the most common cause of thigh pain. And more often than not, that's due to sciatica, either from a pinched nerve in the lower back or less commonly from your sciatic nerve getting pinched in the buttock. Now, your hamstring muscles run through the back of your thigh as well, and many people have stiff hamstrings. But it's rather rare that stiff hamstrings actually cause pain. So if you're having back of thigh pain, I would rule out any type of sciatica from the lower back or buttock before you go stretching your hamstrings. To stretch the hamstrings, you would sit with your leg out on a table like this and lean forward, but that puts a lot of tension on your sciatic nerve. And often irritable nerves don't like to be stretched and get more angry when they're held in a static stretch like this. However, doing a nerve glide, where you sit at the edge of the bed, kind of slump over just a little bit, and then glide your leg back and forth, kind of going into a hamstring stretch position, but not holding it. So moving back and forth, that helps slide your sciatic nerve back and forth through the tissues that it runs through. Now, many people will say you should move your head along with the leg to help relieve tension on the sciatic nerve. I find that just gets more confusing for patients, and all that's really important is that you're moving the leg. So if you want to try moving your head up as you move the leg up, you can certainly do that, but for most people, I just recommend move the leg through the range of motion that it feels more comfortable with. So that's the overview of thigh pain, but chances are one of those problems probably bothers you more than the other three. So to learn more information for front of thigh pain, check out this video over here. Outer thigh pain, this one over here. Inner thigh pain over there, or a whole back pain and sciatica playlist down here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos.